Those people who are the stove, get yourselves ready. As the midwife, we can parade as we come into what the same way we had paraded in the beginning. Please let us parade. And she comes to investigate the parade, inspect the parade. Let us come, midwives. Let us stand up and get into our parade. Let us use enough energy. The way we had paraded before, don't forget. And leave space in between you. Leave space in between you. As we had paraded before, please leave space in between you. Yes,
Yeah, our association was established in 1948, 71 years now. So one of our objectives is to take services here at IDM. And we have a membership of 708 members nationwide in all districts of Uganda.
Are we inside?
Yes, please.
Thank you.
Push, baby, push. Push, man, don't worry, the baby's coming out. Like this, we take for the boy. The baby will now do what we call external nutrition. Now they can take and rest. Now they until your shoulder comes under the hips is moving.
University. Now that is Kampala International University, well represented with also midwifery students. We have people from the prisons, Honorable Minister, those who deliver prisoners who have babies. That is Mulago Specialized Women and Neonatal Hospital. Those are the public health nurses. That is a representation from the Ugandan Midwives Association. Gulu Hospital well represented. Kawempe Referral Hospital well represented. Naguru Hospital well represented. Mulago. Until it says well done, I'll never depart from the golden rule.
Today's theme of the International Day of the Midwife is Midwives, Defenders of Women's Rights. Could not be more pertinent as today. Midwives, you are the public health heroes. You ensure that a woman can have a healthy pregnancy. You ensure that a woman gives birth to a safe and healthy baby. And you provide essential care for the newborn baby, among the basic human rights that we all know. A bridge between communities and traditional health facilities, midwives, you are at the center. Midwives, you deliver vital health services that are key to reducing maternal deaths and making childbirth safer in remote and underserved areas, including in humanitarian settings. Midwives not only save lives, they also empower women and couples to make informed, healthy choices. As we celebrate 25th anniversary of the International Conference on Population and Development this year and its landmark program of action, distinguished ladies and gentlemen, we are reminded of the paradigm shift. It marked moving from national, economical driven family planning towards a focus on sexual and reproductive health and rights. At UNFPA, Honorable Minister, our guest of honor, distinguished guest, we actively promote midwifery education, training and support, advocating for stronger workforce policies and the integration of midwives into formal healthcare systems. Distinguished ladies and gentlemen, in more than 120 countries, UNFPA helps align midwifery training curriculum to global standards. We have supported the strengthening of midwifery schools and we have built the capacity of midwifery tutors. At the same time, we work with midwives and the medical associations to create an environment where midwives have formal health services and are seen both by the mothers and the medical professionals as a crucial part of the maternal health care. Ladies and gentlemen, honorable guests of honor, in Uganda, UNFPA has worked with the Ministry of Health and the Education Ministry to improve midwifery standards. And thanks, guests of honor, distinguished ladies and gentlemen, our heroes midwives, thanks to the government of Sweden. And we're pleased today to have the government of Sweden represented here by the ambassador himself, who will be speaking to us shortly. Since 2010, through the support of the government of Sweden, 590 midwives have benefited from the midwifery training, bursary, and bonding program. So far, 451 of them, Honorable Minister, have completed the training, of which 306, representing 68%, have been deployed across the country. This has been one of the strategic interventions to address the midwifery deficit, especially in the hard-to-reach areas of the Karamoja region. We have also, guests of honor, worked with your ministry, Ministry of Health, to strengthen the National Midwifery Association that has improved, and we know is going to continue to improve, professionalism among the midwives. We have supported the enhancement of the regulatory framework for midwives and the midwifery practice to ensure accountability. We have supported Ugandan Nurses and Midwives Council to establish a geographic information system that will help track nurses and midwives in the country to ensure that proper deployment and validity of practice is rendered to the community. We are happy to note, guests of honor, distinguished ladies and gentlemen, that in Uganda, 7 out of 10 births are now conducted by a skilled provider, usually a midwife. And thanks to the contribution of midwives, the maternal mortality ratio has reduced, as we heard, from 506 deaths per 1,000 live births to 336 deaths per 1,000 live births between 2001 and 2016. Guests of honor, the gains notwithstanding, it is also crucial to recognize that midwifery practice in Uganda is facing some serious challenges. It is also crucial to note that although different stakeholders, including the World Health Organization, recommends that a midwife should deliver not more than 175 mothers a year, guests of honor, you are well informed that a midwife in Uganda delivers twice as much as this number. It is important to note that many of the midwives trained under the bonding scheme are yet to be absorbed. As UNFPA, we recommend, guests of honor, distinguished partners, that the government puts in place measures to improve the midwife to patient ratio and help reduce burnout of an already overburdened workforce. Guests of honor, at the global level, UNFPA, in partnership with other United Nations sister agencies like WHO and UNICEF, we are soon, in collaboration with the International Confederation of Midwives, going to launch a report entitled Strengthening Quality Midwifery Education for Universal Health Coverage 2030. Guests of honor, this report provides a compelling evidence that with investment in training, in support and integration, midwifery can ensure the best health outcomes for women and their newborn children. As I conclude, as UNFPA, all stakeholders, all partners, all citizens to join UNFPA in supporting midwives. Let us show our utmost appreciation for their tireless effort, their tireless work they do to safeguard the health and well-being of women and babies in Uganda. Midwives, indeed you are heroes. And as you have said, I think in your code of conduct, in the song that you said, until you reach your goal, midwives, we will not stop our unequivocal support for midwives to ensure that no mother dies giving birth and that every childbirth is safe. Thank you very much.
I'll never